I think, yeah.
Don't move too much, Vijaya. See, you moved now, no, right? So it becomes dark.
Okay, it's live. Okay,
It's live,
over to you, Rupaji. Over to you, Rupaji. It's live. Whenever the time is ready, you can start. Okay.
1 minute, just it.
Namaskar everyone. Good morning to all our viewers in India and good evening to everybody in the United States. We welcome you to this workshop on yoga for joint pains hosted by American Academy of Yoga and Meditation. For our new viewers who are joining us for the first time, I would like to take this opportunity to introduce you to the American Academy of Yoga and Meditation. American Academy of Yoga and Meditation is a non-profit organization for physicians, researchers, medical professionals, and practitioners of yoga and meditation. The organization is dedicated to education and research in the field of yoga and meditation by fostering an interdisciplinary approach of linking science, arts, ethics, and spiritualism to improve ways of human life. Coming to our workshop today, joint pain can be discomfort, pain, or inflammation arising from any part of a joint, including cartilage, bone, ligaments, tendons, or muscles. Osteoarthritis is an altered cartilage-related joint pain, a leading cause of disability and loss of functions in elderly population. Yogic interventions have shown promising changes in reducing pain, morning stiffness, and increased flexibility, muscular strength, and overall quality of life in osteoarthritis patients. The multifactorial approach of yoga therapy includes asanas, that is physical postures, breathing practices, pranayamas, meditation, which is dhyana, spiritual and emotional cultures and discourses may help to ameliorate osteoarthritis symptoms. Now, I take this opportunity to introduce our dear Dr. Vijaya Kauri ji and Raghu ji. Dr. Vijaya Kauri ji has a PhD in yoga from Swami Vivekananda Yoga University, Bengaluru. Her PhD research was conducted in Los Angeles in a hospital setting, and the papers were published in peer-reviewed international journals. Since obtaining her doctorate degree, she is professor at Vivekananda Yoga University, and Dr. Kavirji is a joint director of research at Vivekananda Yoga Research Foundation at Newark, California. And we come to our Sri Raghu Bharadwaj, who is a founder and managing partner of Yogaish Foundation, USA, bringing comprehensive yoga and meditation practices on a virtual platform to the community. And Sri Raghu Bharadwaj is a supply chain consultant for large Fortune 500 enterprises by profession for over 2 decades and applies technology to solve supply chain problems. He is currently pursuing his Masters of Science in Yoga Therapy with Vivekananda Yoga University. And our dear Raghuji has suffered his share of lifestyle issues with wear and tear of knees with active weekend sports such as cricket, golf, and stress-related ailments due to extensive work-related travel such as diabetes, hypertension, and high cholesterol levels. He has taken to path of yoga seriously in the last few years to apply the learnings from yoga therapy in a formal and dedicated fashion with amazing and positive results, which we would all like to hear from him and hope to have a few questions from the audience to know more about this wonderful journey so far. Under the guidance of Dr. Kavuriji, the journey of evidence-based research and application of yoga for joint pains will be discussed, including the research that Kavuriji has done on this subject, and together they are bringing the demonstration of yoga therapy sequence for arthritis-related joint pains that Raghuji will demonstrate to the audience here today. Now, without further ado, I hand over the spotlight to Dr. Vijaya Kauriji and Raghuji to guide us through an invigorating yoga practice for joint pains. Over to you, Dr. Kauriji and Raghuji.
Greetings from Vivekananda Yoga University and Vivekananda Yoga Anusandhana Samsthan in Norwalk, Los Angeles. My heartfelt congratulations to American Academy of Yoga and Meditation for bringing this month-long virtual conference, especially during this month where we celebrate International Day of Yoga. And thank you for inviting me to this webinar of Yoga for Joint Pains. And it is a great pleasure to be with you all this session to share our thoughts.
Welcome again, Dr. Kauriji. Yeah, it's very heartening to know the background and the area of research that you have, which, as Rupaji explained, I have suffered quite a bit of my share. Would like to ask you a few simple questions initially to initiate and engage the dialogue with you. Can you explain a little bit to our audience on what arthritis is and what are the different types of arthritis that we typically suffer?
So arthritis is a medical term that literally means joint inflammation, and it is specifically synovial joint inflammation. There are three types of joints in our body, which is immovable, that is in the skull, and then and the mandible also, and little movement like in the spine, in our spine, and then we have all the other joints, the shoulder joint, the knee joint, the hip joint, etc. That have, those are the synovial joints, and so it has a capsule of synovium in it, and so that is the problem areas for arthritis. So when we say arthritis, it is not the other areas, but of course the spine also has arthritis in it, but it is more, when we talk about arthritis, it is more for the bigger joints. And there are few types of arthritis, but specifically we can name 5 types. That is osteoarthritis, rheumatoid arthritis, that is RA factor has to be there, and it's a hereditary problem, and it's an autoimmune problem, the rheumatoid arthritis. And of course, osteoarthritis is a aging problem. So most of the population, about 80% of us, 90% of us do go through osteoarthritis at one point of our lifetime. And rheumatoid arthritis is more of a hereditary autoimmune disease, and we will talk about it a little bit later. And of course, psoriatic arthritis is skin related. So there are bumps, and then it goes to the joints, and then that's how you get arthritis from the skin problems that one might go through. And gout is the uric acid formation, and especially it is formed in the big toe especially, and mainly it is more prevalent in men. And of course, we have lupus that is also, that affects all joints. Right. And of course, people with fibromyalgia also think it is arthritis, but it is not. People do generally mistake fibromyalgia as arthritis because it is the muscle pains all over the body, the nervous system is overacting, and then it also affects the joints.
Very nice. Very interesting to hear the details. Yeah, and you mentioned rheumatoid arthritis. We have not talked a little bit, not much on that. What would you suggest would be the age group that you typically have rheumatoid? It's a lot more prevalent, correct?
It is from 20 years onwards, the rheumatoid arthritis might affect, and usually it is during stressful events, like in a woman's life, during delivery, during the birth. right? And rheumatoid arthritis, for some reason, it affects women more than men, 5-to-1 ratio.
Wow.
Maybe you're surprised, but it is 5-to-1 ratio, and it can be passed on to the women only. So it is the female population is carrying it more. The RA factor is more in them, and it can affect anywhere from 20 to 50. Whereas osteoarthritis, if you compare, it is usually around after 40 or 50. Your knee is hurting or your hip is hurting. It's mainly starts with the knee because that is the weight-bearing joint for osteoarthritis. But for rheumatoid, it is all the little joints. Your finger joints. These are the ones that start hurting, and when it goes untreated for a long time, they can go out of shape. So you do find like the curved fingers like this, and out of shape joints, and even the toes. If you look at the people who really suffered a lot of rheumatoid arthritis for a long time, you see that the big toes are like almost, they're not straight, but they're almost to the side. So deformity happens in rheumatoid arthritis sooner than in osteoarthritis. So the RA factor is the one. If RA factor is present, then they are prone to rheumatoid arthritis. So if they don't have the RA factor, then usually they do not have the rheumatoid arthritis.
Thank you. Very, very wonderful information there. So let's come to the topic of yoga, right? Yeah, there's a lot of history and research. I think you have done research on your end, right? What would you see how yoga can help with arthritis, right? In general.
So when we talk about osteoarthritis, it is mainly a lifestyle problem, right? So sedentary lifestyle. So you're sitting for a long time and you're working on the computers. All the IT people, that's what they do. And when you get up, because there's no movement, the body needs movement, right? All joints need some kind of a movement. So when you're sitting for long hours, when you get up, you feel that pain because there's no movement. And when you walk like few steps, then you're okay. So, but that will be the beginning of the arthritis. So sedentary lifestyle is one problem that is kind of giving you the arthritis thing. And also very active lifestyle, like running every day. See, after certain age, human body is not meant to be running, right? Even after 50, 60, if you have a habit of running, or even violent sports like basketball, like football, all these are kind of very highly active sports. So those are the ones that really take a hit. It's a wear and tear problem. And when we don't move also, you have that stiffness, and you get the problem of osteoarthritis. And you're moving too much also, you have the problem. So everything has to be done in a samatva, in a equanimity phase, right? Everything has to be the right and of course right amount. And of course obesity is another problem, because the weight bearing joint, right? Your knee mainly, and then the hip. So that is a weight bearing. So obesity also contributes to osteoarthritis. And of course, family tendency. I mean, when we say osteoarthritis, every family has it, right? But some people have it earlier, like 40 years or so. Then if my mother had at 40, then I am prone to get it around 40, unless I somehow manage my lifestyle in such a way that I can prolong that onset of the, I wouldn't call it a disease, it is just a aging process. Arthritis is a aging process, osteoarthritis especially. Yeah. Yep. And how does yoga help? So besides managing the lifestyle, the yogic view of the human body, we go into this Panchakosha theory, where every person has these 5 layers, like an onion peel, right? Like you peel off one layer after the other. So it is not, okay, this is where this layer ends and this is where this layer starts. Everything is permeating into the other. So first we talk about, there are 5 koshas, that is Annamaya kosha, that's the physical body, Pranamaya kosha, that's the breathing part, body, or the subtle body. And then we have the Manomaya kosha, Vijnanamaya kosha, and Anandamaya kosha. I'm sure in other sessions you might have had exposure, but I'll just quickly go over. So in the Vijnanamaya Kosha and Anandamaya Kosha, those are the more subtler layers. There are no, the body might have a problem, but in the Vijnanamaya Kosha, the human has gone into so much deep into the knowledge layer that they know what is right, what is wrong, so nothing bothers them, right? If they did something, it doesn't bother because they did everything according to the law of nature. They didn't go against. So they reacted the way it is supposed to be done. So when we do something exactly the way it is supposed to be done, then we don't have any regrets about the result, right? When we act according to what we want to do, that is when the regret comes, right? Regret in the sense, like your expectation was something and the result was something else. So that is when we get stressed out. Yeah, so this starts only at the Manomaya Kosha. In the Anandamaya Kosha, it's in bliss like Ramana Maharshi, like our Chinmayananda, or all the Swamijis, or even Jesus Christ, in all the godly figures, or all the guru level figures. But Vijnanamaya Kosha is where all our other masters are reaching to be. And Manomaya Kosha is the body of will. I want to eat right now, even though I'm not hungry, I see something, I have to go grab it. And it is body of will. So if I want to not talk and watch TV for 10 hours, I'll go ahead and do that. Nobody is stopping me because my Vijnanamaya Kosha, I'm not letting it come in. Even though my Vijnanamaya Kosha says, don't watch TV, it's not good for you, you're wasting time. But body of will is saying, no, I like this movie, I can watch 10 movies, nobody is there to bother me. So that is where, when we act like that, then after the 10 hours of TV, then I'm kicking myself. Why did I do that? Right? I shouldn't have done. So that is where my anxiety is coming in. That is where my stress is coming in. And when the stress levels increase, that is where it is affecting my pranamaya kosha. That is the breathing. So when I'm anxious, I'm breathing fast. When I'm upset, I'm breathing fast. Right? So because of the breathing haphazardness that is happening because of the Manomaya Kosha, from the Manomaya Kosha, it is coming down to Pranamaya Kosha. And all the breathing haphazardness and the breathing blockages, and in the Pranamaya Kosha, we have Panchapranas. That is about, if you say the energy is 100 of the Pranamaya Kosha, there are 5 Panchapranas, and it is equally divided. Unless all the 5 pranas are in balance, there is, and if it is not in balance, there is a disease, because I'm not at ease, right? That is why the disease. So suppose I am breathing so fast, so my mukha prana is taking the energy from my apana, samana, dhyana, and udana pranas. So those are lacking, right? So that is when the disease starts in the body. So the Manomaya Kosha is stressed for some reason, for whatever stupid things I might have done, into the Pranamaya Kosha, and from there it is affecting the body. And the body gets affected because of the hereditary tendency also, right? Stress doesn't affect everybody the same way. If I had weaker lungs, because my father had asthma, I had weaker lungs, it comes to me as asthma. If my mother had arthritis, it comes to me when I'm stressed out, it starts as pain in the joints. So we kind of speed up the process if the lifestyle is not managed well. So that is where yoga is going to come in handy to decrease the stress levels and to maintain a good lifestyle with discipline, right?
I wish I had met you a lot earlier than last year, right? But I knew a little bit about yoga, but didn't know all the nitty-gritties of the connections here. And we have been working for almost 7-8 months, and you have been my guru, my coach, right? And why don't we take a look at some of the practices, right? That special practices that you have had me do, right, in order to elevate. And I can, after the session, it's almost like a 30-35 minute session, right? And we have kind of trimmed it down to fit the window here, right, as you have guided us to do. And I know there are some practices, practitioners will also be there. So for the practitioners who want to follow along, right, make sure that you understand that this is a shorter version, and eventually we have no issues sharing a full 1 hour version of this video that could also be helpful to you, right? Either through AYM or through Yogayesh, we can definitely do that. So let's have that. Sorry.
Raghuji, let me explain for a minute what are the special techniques we are going to be doing here.
Absolutely.
So the first one is Karna Vyayama. So that is simple loosening practices where we are moving every joint, little joints. So going with the finger rotation and have fingers movements and all that thing. So going from the fingers to the neck and then from toes to the hip joint. And then we do the Shakti Vikasaka, that is to strengthen the muscles around the joint area. So that is what we are going to be, Raghuji is going to be demonstrating in the video.
Thank you. So Ritishji, you want to play or you want me to play?
Raghuji, go ahead and play that. I choose it.
Now that we talk about the joint pains that one might experience.
Yeah, you might want to increase the volume a little bit.
Karna Vyayama, that is simple loosening. Your fingers nice and now make a fist. Come inside, wrap the fingers around. Open. And do that few times. And then open your fingers. All the fingers. And with a nice smile, eyes closed, focusing on fingers and relax. Now we move on to the wrist. Make a fist, come inside, wrap the fingers around. And now rotate. Feeling the muscles, feeling the wrist joint.
Vidyaji, may I request you to talk along with the video? So even if the audio is something,
So I think I can switch to my version. It will be loud and clear.
Raghuji, make sure that when you're sharing the screen, share the audio of the computer, okay?
Yes, yes.
Yeah, you might want to replay again. Yeah.
Yeah.
Thank you.
It says I cannot share the screen. Can Ritishji make me?
Yeah, Ritishji, please make Raghuji the host.
And after 5 rounds, relax. Relax. Now we move on to the neck.
Yeah, I think you have to switch off the video.
Upper body, Vipulikarana Vyayamas, that is simple loosening practices. Bring your hands forward and move your fingers nice and easy. Now make a fist. Thumb inside, wrap the 4 fingers around and relax. Open the hands. Make a fist. Open. And do that few times. And open your fingers and gently rotate your hands.
In the neck, inhale, center, exhale. Look
Okay,
over the right
all the
shoulder.
fingers
That's fine.
and opposite direction. With a nice smile, eyes closed, focusing on the fingers. And relax. Now we move on to the wrist. Make a fist, thumb inside, wrap the 4 fingers around, move it up and down. Your hands are straight at the shoulder level. Slowly inhale and exhale. Remember, these are simple loosening practices. And now rotate. Feeling the muscles, feeling the wrist joint, all the way to the elbow. Opposite direction. We generally do this at least 5 rounds and relax. Relax. Now just gently move your shoulders up and down. And simple rotation. Whatever you're able to do. Opposite direction. And fingers on your shoulders, elbows together. As you inhale, take it up. And exhale. Couple more times, slowly, slowly. You're sending the breathing, the prana into the shoulder joint, the ball and socket joint, opposite direction. And after 5 rounds, relax, relax. Now we move on to the neck, which is the most important part. Gently bring your neck down to the chest. Inhale, slowly look up as you inhale. No jerky movements. Exhale, slowly down. Very good. Now looking over the shoulder, twisting the neck. Inhale, center, exhale. Look over the right shoulder. That's fine. On to the other side. We do this maximum 3 times. Don't overdo the neck movements and don't do it very fast. And we bend the neck, stretching the neck, ear to the shoulder. These are very simple and very effective practices for releasing the stress, any neck pain, minor neck pains you might have. And we move on to the rotation. Chin down. And inhale to one shoulder and up. And as you start exhaling, ear to the other shoulder and chin to the chest. And after 3 rounds, opposite direction. And relax. Keep your eyes closed and relax. Gentle movements. Now we move on to the simple loosening practices for the lower body. Legs forward.
Yeah.
Yeah. Okay. And move your toes slowly. If your toes are hurting a lot, you can bend your leg if you're able to and do passive rotation. Hold on to your toes with both hands, hold on to your foot and nicely do passive rotation, moving them back and forth. You can go toe by toe or you can do all toes at the same time, depending on the pain level you might have. Going backward, forward and rotate. Okay? When you're able to move all your toes, just put your legs together and move all the toes back and forth with your breathing. Close your eyes, focusing all the prana into your toes, the little joints. Arthritis happens to all the joints. It might start in one place, but it might hurt one day in one place, the other day in some other place. Now, your ankle joint, inhale, toes towards you, and exhale down. Slow movements. Inhale and exhale. After 5 times, we will rotate. Rotate your feet. You can do both feet or you can do one foot at a time, depending on your comfort or discomfort that particular day. Don't move the legs. It's just from the ankles. And after 5 rounds, opposite direction, and relax, relax, relax. Fingers pointing backwards and relax. Now we move on to the knees. Bend your right leg. We do the knee bending. As you inhale, stretch your knee. Stretch the leg. Heel is above the floor. Exhale, bring the leg towards you. Inhale, stretch it out. And exhale. After 5 rounds, we move on to the left leg. Inhale, stretch, and exhale. The general rule is, as we inhale for any extensions and we exhale for bringing it in or bending. And now going back to the right leg, we do the knee rotation. Don't move your foot. Your foot is all relaxed. As you inhale, take it up, exhale down. Your foot is relaxed. Don't move the foot. Good. After 5 rounds, opposite direction. And relax. Now the left leg. Rotate. Opposite direction after 5. And relax. Place both palms on your knees, on your kneecaps. We do kneecap tightening. As you inhale, tighten your kneecaps. Don't move any other part. You're just tightening that. Pulling up the muscles. Exhale, relax. After 10 times, relax. We move on to half butterfly with the right leg. If you're not able to bend it totally, don't worry, whatever you're able to. Even if your foot is on the floor, that's okay. Just start moving the right leg. After 20 times or so, then you hold on like rocking a baby and move it sideways. This is for the hip joint. With normal breathing. And relax after 15 to 20 times. Now your left leg. And rocking a baby. And relax, relax. Now we move on to full butterfly. Your soles of the feet are touching each other. If you're not able to do a full butterfly, that's okay. You can just continue your practice with the half butterfly for a few days, and then eventually you will be able to do the full butterfly. Once you're at the full butterfly, do it like 20 to 30 times, flapping the thighs, and relax. Relax. Come to a standing position, and we finish the Sitilikarna Vyayamas with waist rotation. Hands on your hips, your legs are apart, hip width apart, and as you inhale, push the hips forward, and as you exhale, push them back. And opposite direction after 5 rounds. And relax, relax, relax. So this finishes the Sitilikarna part. Relax. Raghuji, now that we talked about Shakti Vikasaka, that is strengthening the muscles around the joints. Suppose we are talking about the knee joint. We are going to be tightening or strengthening the muscles around the knee area, that is the thigh muscle and the calf muscles. Or if we are talking about the fingers, all the muscles around that. So let us go ahead and demonstrate few Shakti Vikasaka, that is the strengthening exercises. We start with the upper body again, legs together, sthiti position. And for the fingers, bring your hands at the chest. As you inhale, throw your hands out and tighten the fingers and hold on to them until the hand is trembling. And as you exhale, relax and bring it back. We do this 10 times. Inhale, tighten the fingers. You should feel the trembling in the fingers, in all the knuckles. And relax. After 10 times, relax. Now we move on to the palms, strengthening the palms. Hands at the chest level and move your hands vigorously, like 15 to 20 times with normal breathing, and relax, relax, relax. Once we are relaxing, we always close our eyes and feel the joint, the area that was worked upon. Now we go for the wrists. Hands forward at the shoulder level. Make a fist, shoulder level forward. And you move your fists vigorously. Vigorously. And relax. Relax. Now we move on to the elbows. Make a fist. Hands down. And as you exhale, bend at the elbows faster. And relax after 15 to 20 times. Now to strengthen the upper arms, that is to the shoulder joints. Make a fist. Your fists are facing each other. And as we inhale, it goes to the shoulder level, exhale back. Faster. Yes. And after 15 to 20 times, relax. Now to strengthen the back muscles, your legs are apart. Legs are apart. Take your hands back. Not, remember, Raghuji, people cannot stand that much apart. Yeah, that's good. Don't overdo it. People will be afraid. Okay. Please stand apart as much as you're able to. And if you're not able to bend down, bend forward, that's okay. According to your limitations, you're still be able to practice all these things. Take your hands back as you inhale, bend back. And as you exhale, bend forward as much as you're able to. Listen to your body. Don't overdo anything. Inhale, come up. And exhale down. Practice this a little slower. 5 to 10 times. Just remember, the head is going up and down, so you don't want to do this practice vigorously or faster. We have to do it with the breathing to feel that stretch in the thigh muscles and the hip muscles and the low back. And relax. After 5 to 10 times, relax. Legs are in. For the thighs, we go on to the thighs, so your feet can be hip width apart or shoulder width apart according to your comfort. And hands are forward. We sit in a chair. As we inhale, we sit in a chair. Make sure your knees are not coming forward. Your hips are going back. Raghuji, you might want to turn to show that your knees are not coming forward. Legs are a little apart. As you inhale, you push the hips back. Very good. And try to keep your back straight. You're just sitting in the chair. Good. You can repeat this about 10 times and relax. Now we go for the calf muscles. You can turn forward. You're almost sitting down with exhalation and inhale, come up. Hands are forward. Exhale down and inhale up. Exhale down, inhale up. Practice this about 10 to 15 times and relax. Relax. Okay, now that we talked about asanas, let us go ahead and demonstrate few asanas that anybody can do it at any time. Of course, asanas should be, any yoga practices should be done on an empty stomach, but your Sitalikarana can be done on a full stomach also because you're just moving all the little joints. We will start with Ardha Kati Chakrasana, which is a simple asana which can be done by anyone. Your feet about 6 inches apart, very comfortable. Yes. We'll start with the right hand. As you inhale, take your right hand to the shoulder level. As you exhale, turn the palm to face the ceiling. As you inhale, take it up, straight hand, feeling that stretch, the blood flow, reverse blood flow. Exhale, relax the hand. Make sure your right upper arm is touching the right ear. Inhale, stretch tall. And as you exhale, slide your left hand along the left thigh. As always, do what your body is allowing you to do. Don't break it. And stay there as long as 15 to 20 rounds of breathing if you're able to. Otherwise, even 5 rounds of breathing is fine. Inhale, come to the center. Exhale, relax. Inhale, stretch tall. And as you exhale, bring the hand to the shoulder level. Feeling the changes, the heaviness that you might feel. Inhale, turn the palm. Exhale, observe the changes with your eyes closed. The heaviness turning into a burning sensation and the blood traveling down from the shoulders into the fingers where you get a tingling feeling. The aim of the asana is to be able to relax in the final position. It doesn't have to be a perfect final position. Wherever you are, just be happy in that position and stay there for longer with a smile and just letting go of all the pains and knickknacks of the body. Now we do the same Ardha Kati Chakrasana on the left side. As you inhale, take it up to the shoulder level. With exhalation, turn your palm. Inhale, up. Exhale, relax the hand. Inhale, stretch, and exhale, bend to your left. Relax the whole body, relax your breathing, relax your mind. Be happy with whatever you're able to do with the given body. And focusing your mind on the breathing and taking your mind to a higher level into the Vijnanamaya Pumsa. As you inhale, come to the center. Exhale. Inhale, stretch tall. And exhale, feeling the changes. Bring the hand to the shoulder level. Inhale, turn the palm. And exhale. Bring it down slow. And relax. Relax. Now we move on to the next asana, Ardha Chakrasana, which is a very good asana for back pain and strengthening the back muscles also. Your legs are about hip width or shoulder width apart. Hands on the waist, all 5 fingers forward. And as we inhale, we bend back. And remember, don't overdo it. And bring the elbows closer together, opening up the chest, which makes it a good asana for any breathing ailments. Stay there for 10 to 15 rounds of breathing and inhale, come to the center. Exhale, relax your hands and drop your chin down a little bit to relax the back of your neck. Relax. A complementary pose of Padahastasana, of Ardha Chakrasana is Padahastasana. Legs together, you can turn forward. And inhale, both hands. To the shoulder level and up, palms facing forward. And exhale, bend forward from the low back, making sure your head is between the upper arms. Only go down as much as you're able to and relax in the final position, closing your eyes. Drop your head down completely. Relax, feeling the heaviness in the head region, stretch in the back of your legs. After 10 to 15 rounds of breathing, hands forward. And inhale, slowly come up. And exhale, hands to the shoulder level and down. relax. Now we will move on to the prone position, relax in Makarasana. We will do a couple of asanas in this position. Bhujangasana, which is again good for the low back and also for any breathing problems. And Shalabhasana, which is strengthening from the low back also, but from the hip region. First, Bhujangasana, Sthiti. Legs together and hands next to your chest, to your lower rib cage, and chin on the floor. As you inhale, come up, your stomach stays on the floor, and close your eyes with a smile. Stay there, relaxing the cheek muscles and the throat muscles. After 10 to 15 rounds, with exhalation, go down and relax in Makarasana. The complementary pose of Bhujangasana is Shalabhasana. We will do Ardha Shalabhasana first. Make a fist of your hands and put it in the groin region. And as with inhalation, your chin is on the floor. With inhalation, lift your right leg up. And stay there for 10 to 15 rounds, breathing. And as you exhale, come down. Take your left leg up with inhalation. And stay there for 10 to 15 rounds, breathing. And exhale, leg down, relax. Now we do with both legs. Inhale, both legs up. And stay there for a few rounds of breathing. Or do this only if you're comfortable. And exhale down.
How's it doing?
Relax in Makarasana. Now we move on to do Viparita Karani. Legs again up the wall, or if you have a sofa, you can put your legs up in the sofa. Be comfortable. So your upper body is down, but your legs are up. So that way it releases all the knick-knack pains. And just observe Raghuji, how he gets up on the wall. Once the legs are up the wall, with inhalation, push them up, slide your legs up, and stay there for a few rounds of breathing. This is an inverted pose, which gives a lot of relief and also the blood flow. Inverted blood flow. And you can chant Akara 3 times in this position. Couple more times. And with an exhalation, bring your hips to the floor, hips down slowly, and you can relax, legs apart and relax here, or just come down Bend both legs and slowly turn your body, upper body towards the wall and come down, and to relax on the floor in Shavasana. It is very important to relax. So now that we talked about the pranayama, generally we will go with Nadi Shuddhi pranayama, which is a very safe pranayama to be practiced by anybody with any ailments. Generally for arthritis patients, we do not prescribe too much of Kapalbhati, so we just do about 1 round of Kapalbhati, 40 to 60 count. Because of sitting issues or back issues, so just to cleanse the lungs for a minute or so, relax. Relax. And about 5 to 9 rounds of full yogic breathing, where you're inhaling, expanding the diaphragm, the thoracic region, and the clavicular region. And while exhaling, you relax the diaphragm, the thoracic, and the clavicular region. And after the 5 to 9 rounds of full yogic breathing, Nadi Shuddhi or Anulom Vilom or alternate nostril breathing is the most safest pranayama. So Nasika Mudra, and inhale through the left nostril, close the left nostril, exhale through the right, and inhale through the right, close, and exhale left. That's 1 round. You can practice anywhere from 9 to 27 rounds of this. It helps in balancing the autonomic nervous system. It balances your parasympathetic and sympathetic nervous system, and there is tons of literature to support this. Make sure your back is straight while with this practice, while practicing this, and your other hand is in dhyana mudra or the meditation pose. And relax after at least 9 rounds of pranayama. We move on to Bhramari. Bhramari, 5 to 9 rounds. With exhalation, we chant Makara. And we can do with the Simha Mudra also, whichever way you feel comfortable. And relax after 5 to 9 rounds of Bhramari. Keep your eyes closed, feeling the inner joy of all the practices you have done, and the mind at a calmer place than before. We move on to Om chanting, anywhere from 9 to 27 rounds. Do few times softer, few times like mentally. And keep your eyes closed and in a blissful place, chanting Om mentally. A sense of gratitude to whatever you believe in, and a sense of gratitude to the nature. what we are able to do with this body, where we are, and how we are able to go on with life with a positive attitude, always with a smile. Come what may, we know we have the strength within us to go through this life. Relax totally. Namaste.
Thank you, Dr. Vijaya Kauriji and Raghuji, for the enlightening session on yoga for joint pains. And now we are open for questions from audience. So kindly, may I request the audience to raise their hands to pose their question. And we have Dr. Vijayaji and Raghuji to answer all your questions. So feel free to ask questions. You may also choose to put your questions on the chat box. Okay, we have Rupali ji. Please go ahead and ask your question, Rupali ji.
Ma'am, if there is pain in knees, how can they do the asanas which are related to legs?
So when there are pains in the body, you're actually addressing the other body pains. So if your knee is hurting a lot, then you are not doing the vigorous practices, but you're slowly doing the Sitilikarna and the Shakti Vikasaka, and then only you move on to the asanas.
Just to add to
So
that,
for a few days, you keep on doing the small, simple loosening movements, and then you go into the strengthening movements practices, and then only you can go into the asanas.
Okay, thank you, ma'am.
yeah, just to give you my own example, right? So I was advised to get knee replacement for both the knees, right? This was 2 years ago. And I've had 3 times, I've had silicone gel injected into my knees, right? So it does have its problems of being painful. And you have to come across how to get over it. Like how Dr. Kauri gave the demonstration and I worked through. I've been doing this for the last 15 months, right? And now I can bend my knees up to 30, 35. You can see some of the asanas, some of the postures I could not do, right? And that's how you improve. You continue to invest time and effort in doing those asanas and slowly every day breathe into it, every day see the improvements. Back to you.
Very good pointer, Raghuji. One has to keep at the practices and slowly you will see the result. Yoga is something that is not like a pill where you take it and then your headache is gone or your body pains are gone. But with persistent practice, you will see the results.
Thank you, Vijayaji and Raghuji. Yeah, so it has to be, it is gradual, right? That is what you're saying, and it has to be a consistent practice. Yeah, thank you. Thank you, Vijayaji and Raghuji. I think next we have Anjanelu. Please go ahead, Anjanelu ji. Ask your question.
Namaste, madam.
Namaste.
Madam, I have a doubt. So we can continue any practices after post-operation rehabilitations according to knee tendons surgery.
You should always listen to your body when you're doing any practices. As we said, all the Sitilikarna practices are very safe and simple. So just keep moving the joints slowly. And then if you're able to do a little bit more, then you progress into the other practices.
Okay. So is there any,
just like
madam, can you suggest
just
any?
like physiotherapy. I'm sorry. Go ahead.
Madam, can you suggest any kind of movements according to this tendon surgery?
the knee tightening, the joint tightening, and moving the leg slowly. If it is your knee joint we are talking about, right? Moving the leg slowly back and forth. That is a flexion of the leg. Raghuji has demonstrated. With inhalation, you move it forward. With exhalation, you're bringing it back. And always make sure you're sitting with a support. Don't sit just like that, because your knee might be hurting a lot more if you are on your own. So take the support of the wall or a chair or whatever you have that is stable enough to hold on to hold your weight. Don't do any vigorous things, and the simple walking is always good, like holding on to a wall and doing few steps until, bending at the knee and all that. Don't do the sit-ups, the Shakti Vikasaka practices that we have shown. Don't do that yet, because that flexion will, tear the knee even badly.
Thank you very much.
Yeah.
Thank you, Vijayaji and Anjaneyaji. I think next we have Dr. Parthaji. Please go ahead, Parthaji, ask your question.
Firstly, namaskar and pranam to all. And in case of Brahmari, I want to ask how many times Brahmari should be practiced at par. When I am sitting, then how many times should I practice? Because it is creating very pleasant feeling. So it seems that I should practice 4 times, 5 times, and so on. But what should be the limit?
Okay, so the limit usually, because this is a therapeutic session, we are dealing with patients, right? With people who have some sort of a discomfort. Yeah. So we always say 5 to 9 times.
Okay.
Anything 5 to 9 times. If it is giving you so much pleasure and you feel so much more calmer, do it up to 27 times.
Okay. Okay.
Yeah.
And two more questions are there. That is there any restriction for any patients that he or she cannot perform Brahmari? He or she should not. Is there any restriction?
Yeah. For epilepsy patients who have seizures, and so those are the people that we do not tell them to do the Brahmari at all. Even Om chanting they cannot do, because that activates their mind. Already they're in a higher state of activeness in the mind. So we want to calm them down, right? Seizures are because of the nerves are like going out of whack. Yeah, so those some patients, like mostly it is okay, but there are few cases we don't want to do Brahmari.
And my last question is, while doing Brahmari, I have experimented that I would like to share, and wanting your suggestion in this case. So while making sound, first just with low intensity, then just slightly increasing intensity. So gradually increase, create some different feeling. Is it right, or it is
whatever
wrong?
Helps you to be happy? First of all, that is a parameter, right? And there are 2 types of Brahmari. 2 types of Brahmaris. First one is Makara chanting, the low humming bee sound. And then we have the male humming bee, that is the that is the highest sound, right? So that is the N sound, like in the kin, pin, N. So it is touching the tongue is touching the upper teeth, behind the upper teeth. So that gives you more vibrations, right? Into the frontal lobe. Yeah. So these are the 2 Makara chantings we do. But that is only for the pranayama meditation session. So that takes you into the meditative state.
Yeah. Okay. Thank you, ma'am. Thank you.
Thank you, Parthaji. Thank you, Vijayaji, for that subtle difference between the Nakara and Makara. Thank you so much. I think we have one last question by Krishnaji. Krishnaji, would you like to go ahead and ask the question on your video?
Namaste, Vijayaji. The question is, the RA and AA can be reversed with the help of the modern medication as well as the yoga practice if it is already onset. If the patient having already suffering from both, And can the regular practice of yoga can reduce because the modern these medications have long-term side effects? Can we reduce gradually the amount of medications with the practice of regular yoga and pranayama practices? I mean, does the yoga have the effect in reducing the medication and curing the disease, not only like managing, curing the disease?
Curing, we will never claim that yoga cures anything, but we will claim that it helps you manage, like reduce the pain levels, reduce the medication. But we will not say, okay, you will be arthritis free or you will be heart disease free. We are not going to claim that. So that is not our intention here, but it will help you manage your lifestyle, change your lifestyle. And that way your stress levels are managed and your disease onset will not progress faster. You can maintain it, right? Wherever you started, your medication definitely goes down, because with other studies that we have done, we've seen that patients have come off the medication as long as they're doing the yoga practice. See, yoga is a 24/7. It is a lifestyle, right? We are not doing just 1 hour of yoga and then, okay, I did my yoga today. No, it is not. Yoga is 24/7. It is a lifestyle change. So that brings about, when you practice every day, what happens is you are calmer inside. So the little knickknacks don't bother you. In the beginning, remember I said, in the Vijnanamaya Kosha and Anandamaya Kosha, the body has the problems, but the mind has evolved into a higher state where we are saying, okay, it's not me. It is for the body, it's not me. Like Ramana Maharshi ji said that when he had to have a surgery for the cancer, he said, yeah, you don't need to give anesthesia. It's only for the body. It's not me, because he has separated himself to the Atma and the body. So when we practice yoga every day, the little knickknacks don't bother us. The pain, we can bear with a little bit more pain than before, right? So yes, yoga practice definitely helps, because it changes our mindset. It changes the way we look at things, because we are always happier and we are always looking at the bigger picture, because we are with the nature, right? We are not just this physical body. Even though it is hurting, it is the body, but we can overcome it with a positive attitude.
Yeah, thank you, Vijay. I just want to make sure that the audience hear from you the importance of yoga. Most of these diseases looks like not curable, but very well manageable with the yoga practice. That will be like you mentioned, it is a 24/7, not just a physical practice, but beyond the mat, we need to carry that yogic lifestyle in a holistic way. So I just want to emphasize to the audience, that's why I asked the question. Thanks a lot for answering that.
Thank you, Krishnaji, and thank you, Vijayji, so much for answering that question and making us aware that how important it is to bring about the change at the subtler level. Really appreciate all the answers. Vijayji, I just have one last question, and being a yoga practitioner myself, I would like to ask this question, and I'm sure audience would love to listen to it from you. How important is it to maintain the awareness on breath while performing joint exercises or any asana for that matter?
So when we say focus on the breathing, so first of all, we need to close our eyes while doing any practice. Of course, make sure you're stable, you're comfortable, and in your own space that is of comfort to you. And when we close the eyes, you're shutting out the world, right? And then automatically we are focusing on the body and the breathing. Okay, it is important. Breathing is very important because it's a bridge between your body and mind. And it is important to focus all the prana. When we close our eyes, we are not wandering. The mind is not wandering outside. Sarvendriyanam nayanam pradhan. So, but once we close the eyes, then the world is shut out. We are in our own world, right? And automatically we are focusing on the breathing. And when the breathing is focused upon, it slows down. And when the breathing slows down, the mind calms down. That is a direct relationship between the breathing and the mind, right? And when we are focusing and the breathing is now slowing down, and I'm focusing on my big toes that I might have, I don't have, but I might have arthritis. So if I'm focusing and moving slowly, just taking all the prana into that toe or the finger, and I'm able to move a little bit more, little bit more, little bit more with my breathing, the slow movement. Now I'm able to open completely and do this. But if I keep my eyes open and I'm doing like a mechanical thing, nothing is happening, right? So it is very important to focus on the breathing, and to focus on the breathing to keep the eyes closed. And in the asana, whatever you're doing, just be aware, bringing that awareness into that particular practice. It doesn't have to be, your Sirshasana. It doesn't have to be your, very difficult asanas or even a simple asana. You just close your eyes, breathe into that position and let go. Once you're in that final position, let go. It's okay. The pain is there. It's okay. Let's breathe into that pain and let it go. So that is why that breathing, that awareness, that focus is very important. That is why for yoga practitioners, the place has to be clean, well lighted, free of insects and things like that, so that we can focus on our practice.
That is really helpful, Vijayaji. Thank you so much. I think we are done. Okay. Okay, I would like to ask one last question by Abhir Guha, and then after that we'll end the session. So please go ahead and ask your question, Abhir Guha.
Go ahead, Abhirji.
Okay. Yeah, let me ask on behalf of Abhirji. So he is asking, what form of nutrition is suggested for yoga practitioners?
Okay, so the yogic diet is a sattvic diet, right? So sattvic diet is neither too spicy, not too oily. It has to be warm food, not too hot, piping hot. It has to be freshly made. And of course, yoga is about vegetarianism. And no onion, no garlic, because those are the tamasic foods, right? But of course, literature has it that garlic helps you in your heart ailments and in your general health. That's okay. Go ahead and take it, but don't overdo anything, right? And eat at the right times and freshly made food, not from 3-4 days ago food, but whatever you're able to do, a vegetarian simple diet.
Yeah, thank you, Vijayaji, for that. And Abhirji, if you want more information and in detail, about sattvic food and everything, we have a program coming up next weekend, which is called as Mind Eat. You're most welcome to join that program, so you'll know a whole lot about, what is sattvic food and naturopathic food and all sorts of food. Yeah. So I think that was a really wonderful session by Kauriji and Raghuji. Thank you so much for that. And as far as our viewers, we thank you for attending the session. And please do check out our website for more information on webinars and workshops that are being hosted throughout the month of June. So every weekend. I think we had a wonderful session. Thank you all. Hari Om.